Hello, ladies and gentlemen. Welcome to Health Life 360. I am Dr. NIK NIKAM, a cardiologist, now helping patients, Medicare patients, with their health insurance and health requirements as far as their insurance is concerned, along with my senior partner, Sudhir Mathuria. Health Life 360 is located in Houston, and here are our contact informations. In this presentation, we're going to look at the Medicare and Social Security changes for year 2022. So let us begin with the feature presentation. Whether you are going through a traditional Medicare involving the Medicare Part A, Part B, Part D, and Medigap, as you can see on your left-hand side, or you're dealing with a Medicare Advantage plan, there are several changes that are going to be directly affecting you as far as your insurance is concerned, as far as your premiums are concerned, and certain coverages are concerned. So we're going to focus upon the premium changes that are happening in the year 2022. The premium changes affect all spectrums of the Medicare program, including Part A, Part B, Part D, the prescription plan, and the Medigap or the Medicare supplemental insurance. Again, they are also tied to your income. If you are a high income earner, obviously you're going to be paying more for your Medicare Part A, Part B, and even prescription plan Part D. So let us look at in detail as what are these changes. As you know, if you are eligible for Medicare, you automatically get Medicare Part A, and you have to subscribe to Medicare Part B. And the Medicare Part B premium, which was $148, it will be going up to $171 for year 2022. Keep that in mind, and you're going to see that deducted from your Social Security check if you are receiving Social Security check, or you may see an increase of approximately $23 rise in your Medicare Part B premium. Next, if you are a high income earner like doctors and lawyers, then obviously your Medicare Part B premium is going to be based on this chart. You can just pause this chart and look at what your income level is, and then it will tell you what your Medicare Part B premium is going to be. There is no way to escape this. You just have to pay this, and it's going to be automatically deducted from your Social Security check if you are receiving Social Security checks. So that is as far as Medicare Part B is concerned. Now, the Social Security came up with the biggest increase, 6.1% for year 2022. That's the greatest news as far as Medicare and Social Security are concerned. But let me kind of caution you that that big increase in your Social Security may be offset by many of the increases in your premiums, copays, and deductibles with Medicare Part A, B, and D. So let's dive deeper into those changes. And here is a chart showing the Social Security increase has been less than 5% for the last 4 decades, with the exception of 2009 when it went up by 5.9%. But since then, it has been around like 3 to 4%, except during the 1980s when we had 12% inflation, and the increase was like 12% or 13%. Now we're seeing this biggest one in the past 40 years, but most of that may go into paying higher premiums if you need healthcare services. Let's continue with that. Along the same lines as we have been talking about, let's look at a little deeper into Medicare Part A and Part B changes compared to 2021. As you can see, the hospital deductible is going to go up from $1,484 to $1,556. Similarly, Part B deductible, which was $203, is supposed to jump to $233. That's a $30 jump. Similarly, the co-insurance for days between 61 and 90 is going to go up and so are the charges for the skilled nursing facility. So every one of these Medicare premiums and charges are going up in the year 2022 compared to 21, as they have done in the previous years. And if you look at the prescription coverage, which is a separate program which is provided by the prescription program plan, that is a standalone prescription plan, or the PDP with the traditional Medicare, or with a prescription plan involved with a Medicare Advantage plan. Nonetheless, the deductibles, which were $445, are going to go up to $480 in 2022. The initial coverage is also going to go up from $4130 to $4430, and the catastrophic coverage is going to be starting at $7,050. So that is as far as the prescription coverage is concerned. And if you are a high income earner, your prescription premiums are not going to be the same as you see when you talk to your agent, because they have to plug in your income level and also whether you're filing individually or jointly, and that is going to make a difference about your insurance premium, which can go all the way from $12.40 up to $77.90. So there are a lot of changes in the Medicare program and also in Social Security in 2022. We need to keep track of all these things. I would say get a spreadsheet and add all these additional charges for each year. Then you see how to budget your finances when it comes to dealing with the increased cost of having Medicare insurance, Part B, Part D, and the supplemental programs. Here at Health Life 360, which is located in Houston, Texas, we serve many Medicare supplemental plans, standalone prescription plans, and the Medicare Advantage plans, and all of these are going to be centered upon the medications you are taking, the doctors you are seeing, the hospitals that you use, plus the county or the locality where you live. This is a very complex process. We sit down with you one-on-one and see what are your current medication insurance policies. We sit down with you and review your medications, review your doctors, review the hospitals you you use, and see what plan works best for you, and also keep you abreast of the new changes that are happening each year. We complete your application, make sure your insurance is effective on the day you want it to be. So I would recommend you to go to Google Medicare and You 2022. It's a PDF file provided by the CMS. I would strongly recommend you to Google that and download and put it in your computer folder so that you can repeatedly look at all the different options and the fees and what are the limitations and what are the things that are not covered, so that you become an educated consumer. The more you know about Medicare Part A, Part B, Part D, supplemental insurance, advantage plans, the better it becomes for you to navigate through these complex insurance policies and see how best it works for you. And beyond that, each year you need to sit down with your agent and review your existing plan and see if there are newer, better, and more convenient plans that can replace your existing Medicare Advantage plan, supplemental program, or a prescription plan. We are here to help you at 360, and you can just contact us through email or send us a letter, and we will be happy to serve you. Thank you so much for watching this presentation. We have numerous videos on Medicare Part A, Medicare Part B, Medicare Part D, Medicare Advantage plan, how to look for Medicare Advantage plan, how to look for a best prescription plan, how to look for a Medicare supplemental program, and of course here this video on 2022 Medicare updates. Thank you so much, and please do subscribe to our YouTube channel, and we will see you next time.